Hello, my name is Dr. Dewan as Raja. Today I will discuss about commonly injured ligaments in ankle injury. Ankle injuries often involve damage to the ligaments that support the joint. The most commonly injured ligaments in ankle injuries include the following. These are arranged from most common to least common. Most common is the anterior talofibular ligament, then the calcaneofibular ligament, posterior talofibular ligament, deltoid ligament, and syndesmotic ligament in high ankle sprain. So we are saying the lateral aspect of the ankle ligaments are weaker and they are more prone to get injured or damaged like the anterior talofibular ligament. On the medial side, ligament is stronger, thicker, so chance of deltoid ligament damage is unlikely or less chance. In high ankle sprain, we may have there is damage to the interosseous membrane and talofibular ligaments. But the most common is the anterior talofibular ligament. It may be alone, may be associated with calcaneofibular ligament injury. So if we go to that anterior talofibular ligament, this is the anterior talofibular ligament. This is the fibula, the lateral malleolus. This is the talus bone. So this ligament is prone to get injured, particularly in case of inversion of the foot. Okay, there is chance of damage to the calcaneonavicular ligament and also the posterior talofibular ligament, but this is most common. Okay, so if we go to the second slide, so let's get anterior talofibular ligament. This is the most frequently injured ligament in ankle sprains, especially in case of inversion injuries. So to remember, this is inversion injury that causes damage to this ligament. Where the foot rolls inward, it's located on the outside, lateral side of the ankle. Then calcaneofibular ligament. The calcaneofibular ligament often injured along with anterior talofibular ligament in more severe ankle sprains. It provides stability to the lateral aspect of the ankle. So if you look at the picture again, okay, so anterior talofibular ligament is most commonly affected. Okay, most commonly affected is the anterior talofibular ligament. We may have damage to the calcaneofibular ligament here. Calcaneofibular ligament, any ligament may be injured. Okay, calcaneofibular ligament that may be damaged. Other ligament may be damaged, but most common is anterior talofibular ligament. Okay, so we got the medial aspect, then we get the deltoid ligament. Deltoid ligament has multiple component. Posterior tibio-talar ligament. Okay, so from medial malleolus to the talus, then tibio-calcaneal ligament we have, tibia to the calcaneum, then tibio-navicular ligament, this navicular bone, anterior tibio-talar part is here, tibio-talar part is here. Okay, so these are the all medial aspect. This is a strong ligament. Chance of damage is less. The posterior talofibular ligament is less commonly injured than the anterior talofibular ligament and calcaneofibular ligament. It typically only gets injured in severe ankle sprain or dislocations. Deltoid ligament, as we mentioned, ligament is a complex, is located on the medial side of the ankle and is less commonly injured than the lateral ligaments. So lateral aspect of the ankle ligaments are more prone to be damaged. Injuries to the deltoid ligament are usually associated with eversion sprain where the foot rolls outward. So in case of lateral ligament, the anterior talofibular ligament or calcaneofibular ligament, those are damaged due to inversion. Deltoid ligament may be damaged associated with eversion. Inversion and eversion take place in the subtalar joint. So remember, eversion sprain, if it is severe enough, may damage the deltoid ligament. Okay, so we got the anterior talofibular ligament. We got the calcaneofibular ligament here, calcaneofibular ligament. On the posterior aspect, we get posterior talofibular ligament here, posterior talofibular ligament. So this may be damaged, but chance is less. More common is anterior talofibular ligament. This is the most common ligament, may be damaged. Second most common is the calcaneofibular ligament. Okay, then there may be chance of damage to the posterior tibiofibular ligament. The least chance for the deltoid ligament, that is on the medial aspect. Okay, so this is the high ankle sprain that may be damaged. The syndesmotic ligament, including anterior, inferior tibiofibular ligament, posterior, inferior tibiofibular ligament, and interosseous membrane connecting the tibia and fibula. Injuries to this ligament are called high ankle sprains and usually occur with rotational or twisting forces. Okay, we got that. So we covered everything about the most commonly injured ligament, mostly the lateral ligament, the anterior talofibular ligament, the calcaneofibular ligament, posterior talofibular ligament, least chance for the deltoid ligament. We have syndesmotic ligament damage, particularly anterior inferior tibiofibular ligament, posterior inferior tibiofibular ligament, and interosseous membrane. In the high ankle, in sprain or twisting movement, we may have damage to those ligaments. But again, most common is anterior talofibular ligament. It may be associated with calcaneofibular ligament. And that's all about the ligaments commonly injured in ankle injury, sprain, excessive eversion, excessive inversion, okay, or twisting movement in the upper part of the ankle joint. So that may happen. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.